5-year-old granddaughter. She just had her birthday party last week at a nature center, and immediately after handling the turtles and snakes and other paraphernalia that were there, and running after butterflies and other things, we all washed our hands with an antimicrobial solution. And when I had a turtle when I was 8 years old, nobody thought about that question. And we didn't really understand what the issues were between animal health and human health. It just didn't come up. When I was in 9th grade, I remember having a youth friend who came to town for a year from Geneva. And who gets in the suburbs of Philadelphia in the 1950s somebody who knows how to speak French fluently? Well, it's because his father was a veterinarian who was doing a 1-year sabbatical from WHO. And he was at the University of Pennsylvania Vet School working in population health of animals. Who would have thought, right? I mean, we never heard those terms in those ways. I mean, if you lived out west and had cattle ranches, I suppose you thought in those terms, but in the suburbs and the cities, you just don't have those ideas in your mind. But it put the first idea in my mind about what population medicine might be about in public health. Well, then I saw a lot of issues when I was a rural local health department medical director in Michigan in the 1970s and 80s. And the first real effect of that was when PBBs got into the food chain. Many of you will remember the PBB contamination. It ends up, it was only about 10 pounds or so of fire retardant instead of a mineral supplement that got into the feed for cattle and pigs and sheep and cows and chickens. But indeed that created a large epidemic of major, not just animal health issues, but also human health issues. And that was the first time, even though I was already an epidemiologist at that point, that I really gave some thought to it, because we didn't give a lot of thought other than maybe even Spanish influenza. When we read the history from 1918, we think about the flu, but didn't really give it much thought about how did that really get into human beings. Well, let's fast forward quite a bit to today. And first, thanks to the Animal Health Institute and to all of you for being here to discuss this. I'm proud to say the American College of Preventive Medicine in human health was the first to really recognize this issue and take it to the House of Medicine. In 2007, our policy committee considered a resolution that went to the AMA, that the AMA passed and said, we want to get involved in One Health. Ron Davis, who was our member and was an active member of our policy committee, and eventually became president of the AMA, unfortunately passed away at a very young age, in his early 50s, from pancreatic cancer, just 2 or 3 years ago. But Ron was a big proponent of this and was very active. He had been a former medical director for the state of Michigan, was very active in these issues during his lifetime. Here's the problem. Okay? When I look at the One Health Commission's chair and members, we see almost all veterinarians. There is one physician who is the chair of the commission, and I don't think there were any physicians who were in the advisory, maybe one physician on the advisory board, and lots of veterinarians. So where are the physicians? We can talk about having this dialogue, but we have to talk about why they're not here. Peter mentioned that, yes, there is no exposure to this in medical school and residency training in general. There's a little discussion, although there's probably a little more discussion today, but that's a little bit like in preventive medicine, we want more nutrition in medical school, and we want more exercise physiology in medical school, and you're competing in these curricula for what are very chock full of other subject matter of departments that are much better funded, frankly. So where are the human epidemiologists working with the veterinary epidemiologists? Well, the biggest problem that we have, frankly, is we don't have residency training money for these positions. We have lots of medical students who want to then enter into public health, general preventive medicine, occupational medicine, and our specialty also includes aerospace medicine. We don't deal with a lot of animals in space anymore, but there's some of that, I suppose. But for the most part, while we have a tremendous interest in preventive medicine training, we have very, very few dollars from any level, whether the federal, state, or local level, for training in these areas. We have about 700 positions a year available. We only fill about 300 to 350 a year. Everybody is taking a hit today on the sequester, but the CDC and the FDA are taking hits also. As they lose funding in one way or another, as they get cut back, they don't lose all their funding. It's a major problem for how we can be prepared, because we end up solely working toward emergency activities and acute issues, and not really being able to plan in the areas of One Health. Secondly, where can we get funding for HRSA, the Health Resources and Service Administration, where frankly today what we're doing in the Title VII funding programs for public health training is we're in competition with the veterinary schools and with the public health schools for funding for residency programs as well. And it's very little money compared to what goes into Medicare training for all the other medical specialties. Preventive medicine is the only specialty that doesn't have a line item training or gets its training money through Medicare. So these are the issues that we're trying to tackle, and that could be helpful in trying to solve some of this divide between the veterinary and the medical professions. Finally, one of the things that Peter is particularly interested in, for example, is we don't do significant epidemiologic studies on large natural populations of animals. We do them on humans. We don't do enough of them on humans, but we do as much as we can. There's a lot of money that goes into that area. But natural populations are probably better for us to study in some ways than confined populations and animal populations. So that would be another area to deal with. So just with those thoughts in mind and with some policy questions in mind, I would thank again the Animal Health Institute and thank all of you for being here and for taking an interest in this area. And let's work together to see if there's some ways we can solve some of these